Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Welcome back to the Federal Drive with Terry Gerton on Federal News Network. More than 20 million U.S. adults live with chronic neocortical brain damage caused by stroke, Alzheimer's disease, or traumatic injury, conditions with few effective treatments. A new research initiative aims to change that by using regenerative medicine to repair damaged brain tissue and restore lost function. Joining me to explain the science and the vision behind the program is Dr. Jean Hébert, Program Manager for Health Science Futures at the Advanced Research Projects Agency for Health. Dr. Hébert, thank you so much for joining me.
Thanks so much for having me as a guest.
We're going to talk about what I think is a really exciting scientific development, the FRONT program. I'm not going to spell out the acronym. I'm going to leave that for you. Tell us what this program is and how it got started.
Sure. I'll spell out the acronym first. So it's functional repair of neocortical tissue. And maybe a little background, since not everyone knows what the neocortex, but it's the biggest outer part of our brain that is most often damaged by many different causes like stroke, neurodegeneration, trauma, and right now there's absolutely no effective treatment to really restore function. There are some treatments like physical therapy, occupational therapy, that may go some way in some patients to ameliorating their status and their function, but in general, for severe cases, the damage is considered permanent. So FRONT is aimed at, sort of taking the permanent out of permanent brain damage and being able to restore function in these individuals.
So that kind of brain science, at least based on my reading, is always been pretty far out on the science frontier. Are there new developments that have made it feel more achievable?
Yes, exactly. There are several new developments that have made it possible to think about, reversing what is now considered permanent brain damage. One is our deep understanding of how the brain forms in the first place. Even before birth and after birth, there's a process where you go from very simple precursor cells or stem cells to a functional brain. And understanding that process gives us a roadmap, a blueprint for how we can regrow new functional brain tissue. So that's the main thing. There's also a lot of work that has been done recently showing that if you put in brain stem cells, they do have the potential to connect with the rest of the brain. So that's already very encouraging results that are highly reproduced in the field at this point.
So you're doing lab science at this point with stem cells and damaged brain tissue?
Yes, but just to clarify, ARPA-H isn't doing any lab work, right? They design these programs and then work with the academic industry and other parties that are interested in making this happen and gets them to come together, work together in a collaborative way to achieve this goal.
What are the biggest hurdles that you see in front of you from translating this lab science into, human trials?
Yeah, so this is ARPA-H, and if there weren't big hurdles, we wouldn't be doing it at ARPA-H. It really is the purpose of ARPA-H is to take on these projects that are, too challenging for more risk-averse entities like academia and even companies. So that's what we're here to do at ARPA-H, is to take on these challenges. So there is a level of technical risk there as we develop the technology needed to achieve this. There may be, unexpected bumps in the road that we will have to address. And it's also, as you've alluded to, really a new way of treating brain damage. And so we'll also have to bring the regulatory entities up to speed on what we're doing. We will essentially have to interact regularly with them so they understand what we want to accomplish. And then, also the scaling technology to bring this to as many people as possible will have to be developed as well.
I'm speaking with Dr. Jean Hébert. He's the Program Manager, Health Science Futures at the Advanced Research Project Agency for Health. Well, let's talk about how this moves forward. It may be light years away, but so many people suffer from the kinds of injuries that you're talking about, stroke victims, Alzheimer, traumatic brain injuries. How will you keep this kind of frontier technology available and affordable?
Yeah, no, that's a very good question, and I hope we're not light years away. The FRONT program is a 5-year program at the end of which we hope to be ready for clinical trials. So hopefully that's not light years.
Right.
So we're not going to be, implementing this in the population until then, but we are already thinking about ways in which we can engage stroke advocacy groups, Alzheimer advocacy groups, to get on board with the idea of this new treatment, or at least to be aware of this new treatment and to hear about their potential concerns with it and to address those ahead of time so that we're ready to implement this in a wide scale once we're ready for the clinic and we've made enough progress to satisfy regulatory bodies that this is a justified next step to go to the clinic.
Anytime you're dealing with the brain, you have, I think, profound issues of identity and consent. So what are you hearing from those support groups around these kind of ethical issues as you proceed down this research path?
Yeah. So certainly the brain, plays a huge role in defining who we are. And so from that point of view, it's important to point out that the tissue that we're growing is a blank slate. It will adapt to the needs of each patient. So whatever the patient is trying to relearn or whatever, needs, that tissue, that brain tissue will be plastic enough to adopt those new functions. So that's one point. The other part of that question was, initially these approaches. So the ethics are paramount to what we're doing, right? Because as you point out, the brain is a big part of who we are. So we've already reached out to ethics experts, and this is something we're going to incorporate more and more as the program moves along, is getting their input as we progress to ensure that any ethical or social challenges are met, ahead of time that we can think about, including issues like consent, which can be tricky in cases where people have permanent brain damage.
So you've talked about a 5-year timeline. What are the next steps in the research, and how will you measure success as you move along?
Yeah. So we've put forth a fairly detailed call on, what we expect in terms of the metrics and milestones along the way of those 5 years. They're very well defined in terms of how well our precursor tissue is made, how after grafting it will wire with the rest of the brain, it will maintain a normal brain structure. So all those, as well as how well it can encode new information as it matures, so that we know it should be useful to patients when they receive this eventually after the program. Those are all very well laid out in the open call we have.
So this sounds like a source of hope for so many people. What do you most want the average person to understand about this program?
Exactly that. This is really a chance at reversing permanent damage, which keeps, at least 20 million Americans, and those numbers are growing, in a state where they don't have their independence, where they require daily care. And it's a real burden for them, of course, but also usually for their families, for caregivers, and it comes at a huge cost to society. because they're not working. And so there's a lot of indirect costs as well. The hope is that we can reverse brain damage and allow all these individuals, the patients themselves, the families, the caregivers, to go back to normal life and or other endeavors that do not require treating brain damage.
I've been speaking with Dr. Jean Hébert. He's the Program Manager, Health Science Futures at the Advanced Research Projects Agency for Health, ARPA-H. Thank you so much for joining me this morning, and thanks for this amazing work.
Thanks, Terry. I really appreciate it.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts. The Federal Drive with Terry Gerton is produced by Eric White and Michelle Sandiford. Our web editors are Daisy Thornton and Darius Lauderdale. For the latest updates, stay with federalnewsnetwork.com or follow us on Facebook and LinkedIn. Up next, the top national headlines from CBS News and the Federal Newscast. I'm Terry Gerton. Thanks for listening.